Hello, everyone. Um, Today is Tuesday, May 9th. Um, I sorry if I'm still congested. I'm still dealing with that. As a matter of fact, I just got off the phone with my primary doctor, so I have to go see an ENT uh because I'm just still congested. But anyways, I went to my follow-up appointment today. I'm officially 2 weeks since my surgery date. Um so today they removed the training plugs. Thank God, cuz those were really annoying. I could not sleep. They were tugging and it hurt so bad. So those are gone. She removed the bandages as well. So at first I did not want to look to see anything, see what I look like. But I went ahead and I took a peek, and I saw it. It's definitely gonna get some getting used to. I To look at yourself and not have any breast anymore. It's like it's pretty shocking. But their skin left. The skin is left there because, like I said, I have to do what they call a delayed reconstructive surgery. So typically, in a regular process where you don't have a situation like me, the doctor will remove both breasts, and then the plastic surgeon would go in, put in spacers, and then a few months after the spacers, you go back and they take the spacers out and put the implants in. Well, since I'm a little special because I keep having infections all the time, mine is delayed, which means they have to do each and every step one thing at a time. So the double mastectomy is first. I have to wait 6 months later, get the spacers. Then another 6 months later, I get the implants. So, um, so she had to leave skin there for when it's time for me to have my other surgery for the spacers. Now the spacers will make it look like I actually have breasts, but right now I have absolutely nothing. Um, it feels extremely weird, very very weird. Because I did have um um could show it to you guys. I did have this like bandage thing wrapped around me for the longest. Um, and that was removed. So now I don't have that on me at all. And it was just this thing here. Um, it's Velcro. So it just wraps around, sorry. It just wraps around the top part of your body and it goes all the way around. And then it's Velcro so you can tighten it up. But a part of me wants to put this back on. I felt a little bit more secure with it. Since I don't have that, like everything, it just feels weird. I'm still extremely sore. Um, I have to do physical therapy, which I told her I didn't want to do it, but she told me that I at least need to go the first couple of times, and after that, if I can promise her that I'll continue to do it at home on my own, then I don't have to go anymore. But for now, I have to do physical therapy. She showed me some exercises I can do at home, and basically, it's just arm exercises. Because to prevent you from getting frozen shoulder. Because like I've been, it hurts bad. Like my whole top part is completely sore. I keep saying it feels like I got ran over by a bus, just the top portion of my body. So I can raise my hand about like right here, and then from there, that's when it starts hurting. It feels tight, but she told me to just kind of push through, do some arm exercises on the wall and whatnot. But she did say I will have to do physical therapy. Um, she said that pretty much she's very, very pleased with the results. She thinks the surgery went excellent, that I'm healing very, very well. She loves the way it looks. She's very excited for that. Um, she also mentioned that they did do like a biopsy while I was in surgery. They have to take a piece of my lymph node and test it for cancer while she's actually in the middle of surgery. So she said that came out negative, which is good. So, of course, all the tissue, since both breasts were removed, all the tissue went, sent off for a pathology. And the report is there was no more cancer in either of the breast. I did have like little things going on in there, but nothing cancerous. And plus, both of the breasts are now removed, so I don't have to worry about what was there because that's gone. So she's really excited, um, super excited for that. That like it's gone. Like this is the best possible outcome I could have. And now it's just healing, um, physically, mentally, emotionally. It's just a healing process. I can now take showers. Um, that's going to be kind of different, because I have to see myself with no breast. That's just, I can't wrap my head around that quite yet. But I can take showers. I cannot be like in a body of water. Like I can't take a bath or go swimming or anything like that for an additional 4 weeks, which is fine. I'm okay with that. I just can't submerge my top part in any body of water for the next 4 weeks. I have to see her again in 6 months, but I still regularly have to see my oncologist because like you do your chemo and everything, and then sometimes you are stuck with side effects from chemo or side effects from the immunotherapy. So I have to do blood work this Thursday. I have to go next Tuesday for my immunotherapy. And then that following Thursday, I have to see my oncologist again because he's trying to keep an eye on something's going on with the blood work, but he wants to keep an eye on it. So I still have to do that, but the surgery is done. It was a successful surgery. Um, I'm not quite comfortable. I'm barely getting comfortable to showing my little bit of hair that I have. It's growing back in. It looks a little crazy right now because I washed it yesterday, but I'm trying to, I guess you could say, train it to go a certain way. So I kind of created this little part. Don't laugh, guys. I created this little part here, and I'm going to try to make sure to train this to go this way and have this to go flat down. If you could see all those little white spots all in here, all my hair is growing back white. That's from chemo. So it's nothing I can do about that. But I will tell you, as soon as I get enough length, it will be dyed. Because I'm not about to walk around looking like Frosty the Snowman. It's just, it can't happen. So yeah, I will be dyeing this because it's a lot of white hair. Also, my eyebrows, as you can see, they grew back in. Um, Also, a few strands of my eyebrows are white as well. And earlier today, I caught myself plucking the white ones and accidentally took a chunk out right here. Not gonna mess with that anymore. I'm just gonna wait and maybe get my eyebrows done. But other than that, like that's it. I have no breasts. I don't, like I said, I'm barely getting comfortable walking outside with my hair just being like this. So I'm not to the point where I actually want to show you guys. Um, I guess it's not like it wouldn't be a bad thing because there's no breast there. It's like looking at a back. But I'm not really comfortable showing you guys what it looks like with no clothes. But as you can see, there's no breast here. This is it. There's nothing. There's nothing there. I'm about as flat as my back. There's nothing there. There's a little tiny hump right here. That's just from extra skin. But the triple D's are gone. And another crazy thing is we went when I had to go to the doctor today for the follow up. Of course, they always weigh you. And I was like wondering something's wrong with their scale. So I ended up already having a new scale. I brought one. And I got on the scale as soon as I was able to come home. I'm actually home now because I can take care of myself. So I'm no longer staying with my cousin. I am staying at home on my own. But I got home and the first thing I did was get on the scale and it matched the weight at the doctor's office. And I was so confused. And I'm like, something is not right. So I told my cousin, I'm like, there's no way I lost all this weight because I've been eating. She was like, you're forgetting the breasts. They're gone. Makes sense. 10 pounds, easy, gone. A little over 10 pounds. It's like 10 point something, almost 11 pounds of breast, of fat. That's gone from my body. So I guess this is my true weight on the scale now. So now I can use the number that's on the scale. But yeah, so I guess the breast took some pounds off. And now I can just start working on just, I still have to get my strength back from the chemo. Um, I can start off with just simple stuff walking. I wanted to go to the gym. I wanted to get a trainer, but I'm not there yet. They don't think it's a good idea. So I have to start off with baby steps. I have to just start walking and doing simple stuff to get my strength up. But yeah, so everything went good with the surgery. There was no more cancer in either of the breasts, any of the lymph nodes, which is good. I still have to see my oncologist. I will continue to do that. I do, however, have to do physical therapy. I guess I'll go ahead and knock that out too. But overall, that's it. I am scheduled for 2 more surgeries, a little farther out. But that's where we're at now. So I will probably do another video next week because, as I mentioned, I do have to have a Keytruda infusion and I have to see my oncologist on, I believe, Thursday. So I'll do another video next week after I see my oncologist and I'll explain what we talked about in that at that appointment. But other than that, that's it. I just wanted to give you guys an update. The tubes are gone. So I'm abreast, but you know, um, I'm trying to be positive. I'm trying my best to not think about it, but I mean, it's gonna be hard, especially if you're a female that's watching this video. You can probably understand a lot more than a male coming from a male perspective. Like I said, I feel like cancer has I lost everything from cancer: my hair, my eyebrows, my eyelashes, and now my breast. That's traumatic. Those things that make you feel like a woman are gone from me. So I just have to, I don't know, we'll see how I do. um and hopefully I could just push through it. I will be getting what they call a mastectomy bra. That's gonna take some time. I have to go to this place and get fitted. So the bra will make it look like I have breast, and I can use that in the meantime until I get the spacers put in. But that's a little bit later. Um, so I'm going to look like I don't have breast for a while, pretty much, unless I wear a mastectomy bra when I go out. Whenever I get that, and it'll look like I have breast. But other than that, that's all the information I have for you. Everything's okay. I've been managing my pain very well. Um, with just Tylenol, I haven't been using what they prescribed except for at night. So now the doctor said I don't have to use that anymore. I could just do Tylenol, ibuprofen, which is fine with me. I'm not like a narcotics type of person. I don't like the way narcotic drugs make me feel, which is why I always wonder how people get addicted to it, because I don't like the way it makes me feel. Like how, I don't know, that's a whole nother subject. But anyways, thank you for keeping updated with my videos. Um, I appreciate all of you guys for being here from the very beginning. And we're gonna keep going. I'm gonna continue to post videos. I would have made a video right before surgery, but the day of, my mind was all over the place. So I do apologize for that, but I will continue to keep you guys updated. Maybe at some point I will feel comfortable enough showing you my scars, and what I look like. But maybe, I don't know. Anyways, again, thank you guys for watching. Thank you for the prayers. Thank you for the texts and the phone calls. I greatly appreciate it. And I will try to make another video next week. Talk to you later. Bye.